Good morning, one and all present here. I am Miss C. Roslyn, Assistant Professor and Head of the Department of Food and Nutrition, Bishop Iba College, Tiruchirappalli. Welcome to this e-content learning session on anemia. In these presentations, we will understand the definition, types, causes, risk factor, signs and symptoms, pathophysiology, diagnosis, nutritional management, and prevention of anemia. Anemia is an important public health and nutritional concern, particularly among women, children, adolescents, and pregnant women. Adequate nutrition plays an important role in its prevention and management. So, let us begin our session and explore the important aspects of anemia and its nutritional management. Thank you. Let's begin. Introduction to anemia. Anemia is a common nutritional and public health disorder characterized by a reduction in the hemoglobin concentration or RBC cell mass, resulting in decreased oxygen carrying capacity of the blood. It occurs when the body does not produce enough healthy RBC cells, loses blood excessively, or destroyed RBC cells faster than they can be replaced. The most common form of iron deficiency anemia, which occurs when the body does not have sufficient iron to produce adequate hemoglobin. Other causes include deficiency of folate and vitamin B12, chronic diseases, genetic disorder, infection, and blood loss. Anemia can affect people of all ages, but it is particularly important among children, adolescents, women of reproductive age, and pregnant women. Early identification, appropriate treatment, and a balanced diet, nutrient-rich diet are essential for preventing and managing anemia. This list presents causes of anemia. Anemia can occur mainly due to three reasons. Then first one, decreased production of RBC cells. The next one, increased destruction of RBC cells. Then third one, excessive blood loss. Then first one is a nutritional deficiency. The most common cause in nutritional deficiency, then particularly iron deficiency. Then also folate and vitamin B12 can lead to anemia because these two nutrients are essential for normal RBC cell formation. The next one, anemia can occur due to acute or chronic blood loss. Examples, menstrual bleeding, gastrointestinal bleeding, injury, surgery, or repeated blood donations. The next one, certain conditions affect the bone marrow or reduce the productions of RBC cells. For example, chronic kidney disease can reduce to the erythropoietin production and result in anemia. The next one, increased destruction of RBC cells. In some conditions, RBC cells are destroyed faster than the body can replace them. This is called hemolytic anemia. It may occur due to inherited disorder, autoimmune conditions, or certain infections. In some cases, chronic inflammatory diseases, infections, and some cancers can interfere with the RBC cell production and iron utilization, resulting in anemia of chronic disease. Folate or folic acid or vitamin B9 is essential for DNA synthesis and normal cell division. RBC cells are produced continuously in the bone marrow, so they require adequate folic acids for proper maturation. When there is folate deficiency, DNA synthesis becomes impaired. As a result, the developing RBC cell precursors in the bone marrow cannot divide normally. They become large and immature, producing a characteristic type of anemia. This kind of anemia is called for megaloblastic anemia. Although the cells are large, they are abnormal and fewer mature red blood cells reach the circulation. This reduces the oxygen carrying capacity of the blood and causes anemia. Vitamin B12 or cyanocobalamin is essential for DNA synthesis and normal RBC cell maturation. When B12 is deficient, DNA synthesis is impaired, causing delayed nuclear maturations while cytoplasmic growth continues. This produces large immature RBC cells. This is called for megaloblast and results in megaloblastic anemia. At the same time, B12 deficiency causes accumulation of methylmalonic acid and homocysteine. Increased methylmalonic acid is associated with myelin damage, which can lead to neurological symptoms such as numbness, tingling, weakness, and balance problems. The next vitamin, vitamin A. Vitamin A plays an important role in iron metabolism and RBC cell production. Where vitamin A is deficient, the body may have difficulty mobilizing and utilizing stored iron, which can reduce hemoglobin production. Vitamin A deficiency can also affect erythropoiesis. Then erythropoiesis is nothing but RBC cells formations and may contribute to iron deficiency anemia. When then vitamin A deficiency can increases to infections because vitamin A is important for maintaining healthy skin and mucosal barrier and supporting normal immune function. When vitamin A is deficient, the mucosal lining becomes weaker, immune cell functions is reduced, the body becomes less effective at fighting pathogens. This can increases the risk of respiratory and gastrointestinal infections. Once then people who are affected for respiratory and gastrointestinal infections, these kind of infections can lead to anemia. The other causes of anemia, then first one is blood loss. Blood loss causes the body to lose RBC cells and hemoglobin. Chronic blood loss can lead to deplete iron stores, leading to iron deficiency anemia. For example, heavy menstrual bleeding, gastrointestinal bleeding, injury, and surgery. These kind of injury and heavy menstrual bleeding can lead to anemia. The next one, increased requirements. The body's need for iron and other nutrients increases during periods of rapid growth and increased physiological demand. If the increased requirement is not met through the diet, anemia may develop. For examples, then period of pregnancy, infancy, childhood, adolescence, and lactation. These periods is very important to iron requirements. The next one is diseases and disorders. Certain diseases can interfere with RBC cell production, iron utilization, or RBC cells survival, resulting in anemia. For examples, so chronic kidney disease, then chronic infections, inflammatory diseases, bone marrow disorders, and inherited conditions such as thalassemia and sickle cell anemia. The symptoms of anemia occur mainly because the body tissues receive the less number of oxygens. Then first one, fatigue and weakness. Muscles receive less oxygens, so energy productions are decreases. The next one is a dizziness and headache. The brain receives less oxygens, causing dizziness and headache. The next one, pale skin. Reduced hemoglobin makes the skin and mucous membranes appear pale color. The next one is a shortness of breath. The body tries to compensate for low oxygens by increasing breathing. The next symptoms are rapid heartbeat or palpitation. The heart beats faster to deliver more oxygens to tissues. The next one, so cold hands and feet. Blood flow is restricted towards vital organs, reducing circulations to the extremities. The next one is a poor concentration. Reduced oxygen delivery to the brain can affect attentions and mental performance. These are the major symptoms that people are affected for anemia. This leads is presents types of anemia. Anemia can be classified into different types based on its causes, mechanisms, and changes in RBC cells. Then first one, iron deficiency anemia, is the most common nutritional anemia and occurs when the body does not have enough iron to produce adequate number of hemoglobin. The next one is a megaloblastic anemia. Megaloblastic anemia occurs due to impaired DNA synthesis and is mainly caused by vitamin B12 or B9 deficiency. Vitamin B12 or B9 deficiency decreases. The resulting is abnormally larger RBC cells production. Next one, anemia of chronic diseases. These chronic diseases develop in individuals with chronic infections, inflammatory, kidney disease or cancer, where inflammations interfere with iron availability and RBC cells productions. The next one is a hemolytic anemia. Then hemolytic anemia occurs when RBC cells are destroyed faster than the bone marrow can replace them. The next one is aplastic anemia. So results from failure of the bone marrow to produce sufficient blood cells and may affect RBC cells, white cells and platelets. The next one, blood losses anemia. Then blood loss anemia develops following acute or chronic blood loss, such as injury, surgery, heavy menstrual bleeding, or gastrointestinal bleeding. The next one is a sickle cell anemia. Then sickle cell anemia is an inherited hemoglobin disorder in which abnormal hemoglobin causes RBC cells to become sickle shaped, leading to their destruction and reduced oxygen delivery. The next one is a thalassemia. Thalassemia is another inherited blood disorder. It's characterized by reduced production of alpha or beta globin genes, resulting in defective hemoglobin formations and anemia. Thus, understanding the specific type and underlying causes of anemia is essential for appropriate treatment and nutritional management. What is megaloblastic anemia? Megaloblastic anemia is a type of anemia caused by impaired DNA synthesis, which results in abnormal maturation of RBC cells. The most common nutritional causes of vitamin B12 deficiency and folate deficiency. Due to inadequate intake of vitamin B12 or folic acid, the DNA synthesis is delayed. While cytoplasmic development continues normally, this produces unusually large, immature RBC cells. These RBC cells is called for megaloblasts in the bone marrow. As a result, fewer mature RBC cells are produced and oxygen carrying capacity decreases. This oxygen carrying capacity once decreases in our blood. This kind of deficiency can lead to anemia. The next is a very common symptoms to included for megaloblastic anemia: fatigue, weakness, dizziness, shortness of breath, and a rapid heartbeat. Vitamin B12 deficiency may additionally causes numbness, tingling, difficulty to walking, and other neurological symptoms. Then folate deficiency is very commonly associated with inadequate dietary intake of folic acids, then increased requirements during the period of pregnancy, malabsorption, and certain medications. Treatment is depending on the underlying causes and generally involve vitamin B12 or folate supplementations and corrections of the dietary or medical causes. Pernicious anemia, gastrectomy, blind loop syndrome, fish tapeworm infestation, pancreatic insufficiency. These are the major causes of vitamin B12 deficiency and megaloblastic anemia. Then first one is a pernicious anemia. Pernicious anemia is an autoimmune condition in which the stomach fails to produce sufficient intrinsic factor, a protein required for the absorption of vitamin B12 in the small intestine. Without this factor, vitamin B12 cannot be absorbed properly, so leading to B12 deficiency and megaloblastic anemia. The next one, gastrectomy. Gastrectomy is the surgical removal of the part of stomach. Since the stomach produces intrinsic factor, gastrectomy can reduce this factor production and subsequently decreases vitamin B12 absorption. This may be lead to gradually vitamin B12 deficiency and megaloblastic anemia. The next one is blind loop syndrome. Blind loop syndrome occurs when a section of the small intestine becomes poorly functioning or bypassed, allowing excessive growth of bacteria. These bacteria can consume vitamin B12, reducing the amount of available for absorption. This results in vitamin B12 deficiency and megaloblastic anemia. The next one, fish tapeworm infestation. The fish tapeworm infestations particularly live in the intestine and compete with the host for vitamin B12. Heavy or prolonged infestations may therefore causes of vitamin B12 deficiency. Then vitamin B12 deficiency can lead to megaloblastic anemia. The next one, pancreatic insufficiency. In the pancreatic insufficiency, inadequate digestive enzymes can interfere with the normal release and absorption of vitamin B12 intrinsic factor in the intestines. Once the reduces of vitamin B12 absorption over time can contribute to vitamin B12 deficiency and also can lead to megaloblastic anemia. The next one, hemolytic anemia. Hemolytic anemia is a type of anemia that occurs when RBC cells are destroyed faster than the bone marrow can replace them. Normally, RBCs survive for about 120 days, but in hemolytic anemia, their lifespan is shortened due to excessive destruction called hemolysis. Then why then hemolytic anemia is a major cause can lead to anemia? Then first one, so hemolytic anemia is inherited disorders. For examples, sickle cell anemia, thalassemia, hereditary related anemia. The next one is autoimmune disease. The immune system attacks our own RBC cells. The next one, some infections. Certain infections can destroy to the RBC cells. The next, some medications or toxins can interfere and trigger with RBC destruction. Then some mechanical destructions, the heart valves or other physical damages to RBC cells formations. These are the major cause can lead to people are affected for hemolytic anemia. The next type of anemia is called for aplastic anemia. Aplastic anemia is a serious blood disorder in which the bone marrow fails to produce sufficient number of new blood cells. This results in a reduction in RBC cells, white blood cells, and platelets, a condition known as pancytopenia. It may be caused by autoimmune reaction, certain medications, chemotherapy or radiation, toxic chemical exposure, viral infections, or sometimes the causes remains unknown. Reduced RBC cells production causes fatigue, weakness, pallor or breathlessness, while reduced white blood cells increases the risk of infections and low platelets levels cause easy bruising and bleeding. Thus, aplastic anemia affects the productions of all major blood cells types and can lead to serious complications if suppose we have to be untreated in these conditions. It's a very one of the complications type of anemia. Inherited causes of aplastic anemia. Inherited aplastic anemia occurs due to genetic abnormalities that affect the bone marrow and blood cells production. The most common inherited conditions associated with aplastic anemia is Fanconi anemia, in which defective DNA repair mechanisms causes progressive bone marrow failure and reduced productions of RBC cells, white blood cells and platelets. Other rare inherited bone marrow failure syndromes include dyskeratosis congenita and also Schwarzman is a diamond syndrome. These conditions may present during childhood or adolescence and can cause pallor, fatigue, recurrent infections, and bleeding due to the pancytopenia. It's one of the major cause. It's inherited. So one of the major cause can lead to this kind of anemia, like aplastic anemia. The next one, sickle cell anemia. Sickle cell anemia is an inherited blood disorder caused by a mutations in the beta globin gene, which leads to the production of abnormal hemoglobin called hemoglobin S. When oxygen levels are low, hemoglobin S causes RBC cells to become rigid and change from their normal round shape into a sickle or crescent shape. These abnormal cells can break down easily, causing hemolytic anemia, and can also block small blood vessels, resulting in painful episodes and reduced blood flow to tissues. So very common symptoms to include in sickle cell anemia. Then first one is fatigue, pallor, jaundice, pain crisis, swelling of hands and feet, and increased to the infections. The last one, dietary management and modification of anemia. Dietary management of anemia focuses on providing adequate nutrients required for hemoglobin formation and RBC cells production. The diet should include iron-rich foods such as green leafy vegetables, pulses, legumes, millets, sesame seeds, groundnuts, meat, fish, egg, and iron-fortified foods. Vitamin C-rich foods such as amla, guava, citrus fruits, tomatoes, and lemon should be included along with iron-rich meals because vitamin C improves iron absorption. Adequate protein, folic acid, and vitamin B12 are also essential. Therefore, Foods such as milk, egg, fish, meat, legumes, green leafy vegetables, and fortified cereals should be included. Vitamin A-rich foods such as carrot, pumpkin, sweet potato, mango, and green vegetables also support normal blood formation. Tea and coffee should preferably be avoided with or immediately after meals because they can reduce iron absorption. Sprouting, soaking, and fermentations of pulses can improve the availability of nutrients. A balanced diet with adequate calories, protein, iron, folate, vitamin B12, and vitamin C should be provided. In addition to dietary modification, the underlying cause of anemia should be identified and treated. And iron, folic acid, or vitamin B12 supplements should be taken when prescribed by a healthcare professionals or dietitians. I sincerely thank everyone for giving me this opportunity to present my e-content on anemia, dietary management and modification. I hope this presentation has provided useful information about anemia and the importance of appropriate dietary management. Finally, I thank everyone for their valuable time and patience listening. Thank you all.